Hello, everybody, and welcome back to the IBS Freedom Podcast. I am joined once again by the beautiful Amy Hollenkamp, RD. I'm Nikki. I always forget to introduce myself, but I'm back at it again. And today we're going to be talking about one of the, if not the hallmark of irritable bowel syndrome. We're going to be talking about visceral hypersensitivity.
Ooh.
Ooh. Yeah, this is
The allure.
This is pretty common. I mean, really, the way you could think of this is this is the mechanism by which tummy pain happens in irritable bowel syndrome, right? So, like, if you're sitting there thinking, "Do I have this? Do I need to care about it?" It's really visceral hypersensitivity. Think pain in the viscera, aka the organs. How common would you say this is amongst your people with IBS and SIBO, Amy? Would you say it's like never there, always there, or like pretty much like commonly there?
I'd say probably like somewhere between like 80 and 90% to varying degrees.
Yeah.
So like, some people say like pain is their primary symptom. And then other people are like, yeah, I have pain sometimes, but like I hate bloating is worse or whatever. There's a kind of a bloating and the pain go together or whatever. But so yeah, again, then there's the weirdos that just like have bloating and diarrhea or constipation with no pain. Sometimes that's like very it's like, what? It seems kind of interesting. But I've had those cases
kind of
too
atypical.
where it's like, whoa, that's interesting. Like you're bloating up really intensely and like you have constipation but zero pain.
Yeah.
So I've had some of those too before, which again are interesting.
Yeah.
But yeah, I think more often than not, it's there to some degree. Like some people have a more severe version of it. Some people, again, like have a version of it where you can kind of address other aspects without addressing it head on, if that makes sense. Like you can kind of address some of the underlying drivers of it without having to do stuff that necessarily is going to decrease the pain like head on, if that makes sense.
So I guess like sometimes you can get away with treating it indirectly versus treating it directly.
Correct.
Like if you happen to work on the microbiome or you happen to work on motility, then kind of coincidentally almost like the visceral hypersensitivity goes away and then you don't ever need to address it specifically in your protocol.
Yeah, correct. Like some people might need added measures specifically for lowering their visceral hypersensitivity in order to address the underlying factors. It's kind of like, to what degree does the person need to address that symptom? I almost think of it again like, the visceral hypersensitivity is a symptom, just like bloating is a symptom, just like constipation is a symptom. Now, again, like there's definitely like laxatives that help with constipation specifically, and some people might need to take a laxative here or there to get things moving because they're really backed up, which helps with symptoms. And I think, again, like visceral hypersensitivity is like that. Like you can do the microbiome changes, you can kind of work on motility and digestion, which could potentially help. Like you could work on all the indirect pieces of the puzzle that actually might be driving it, but not necessarily have to do any symptom management, where I feel like there's other people that really benefit from doing some symptom management and working directly on like pain, potentially inflammation first. First, or again, in conjunction with doing other things.
And I agree. I think that oftentimes, like the question of, do we treat the visceral hypersensitivity and the pain as a distinct entity, or do we work on everything else and see what happens with it? Most often I'm making that decision, or like the patient and I are making that decision together based off of the severity of the pain, right? Like if somebody has very mild episodic pain, like I remember one lady, she said that she would get pain for just like a few minutes right before she had a bowel movement every day.
Right.
But it was only for like the minute or two. It was literally like as the stool was moving through her colon, it was like she could feel that, and that was eliciting pain. And that was it. Otherwise, she didn't get a lot of pain. So
Right.
that kind of a situation, like maybe we won't treat it directly. But somebody who's in constant pain or very severe pain, and that's a really like big part of their symptomology, then we probably are going to try to manage it head on, at least to some degree. And I think it's kind of analogous to any other like chronic pain syndrome, right? So like you could think of migraine, you could think of fibro, you could think of joint pain. Like, are you going to treat the root causes and treat the body holistically and hope that the pain goes away? Or are the migraines severe enough that you actually need to have a prescription or an NSAID or something on board to mitigate the pain so that you're able to function better?
Right.
So that's kind of how I think about it. And it's worth mentioning while I'm on that brain wavelength that in my opinion, like we're going to talk about the mechanisms here that are understood right now, but this is very, very analogous to the world of chronic pain in general.
Yeah.
And it's a fascinating, squirrely kind of rabbit hole to jump down. But like when I had chronic low back pain, to use this as a parallel, looking back now, I strongly believe that it was not because of a local tissue injury. I don't think my back was actually injured or inflamed. I think what was happening for me is that I was otherwise injured or inflamed or compromised, like after the concussion, for example, that I talked about way back in episode 1. But I think that there was neurological compromise and inflammation that was such that my ability to regulate pain signaling in the brainstem and the brain went out to lunch.
Right.
That was not working appropriately. And then I was getting the experience of pain, even though there was no noxious, painful stimuli present. So
Right.
that's very important to discern, is that we have something called nociception, which is where like the neurons in the body that perceive tissue damage and irritation and injury, like nociception is where those neurons are firing off and they're registering that painful stimuli.
Right.
But we don't feel pain simply from the nociceptors going off. Those nociceptive neurons have to communicate with other neurons and they have to get the message up to the brain. And once you get the signal up to the wrinkly bit, the cortex of the brain, that's when you consciously recognize and you're aware of and you experience pain. But those are two completely different things. You can have nociception without pain and you can have pain without nociception. So there's a lot to talk about in this episode. There's the inflammation thing that you've already mentioned briefly once. There's also some immune and like histamine stuff potentially. There's some neurotransmitter stuff that we could talk about briefly. But if I may, can I be just maybe slightly boring but informative at the same time?
Please.
Excellent. So I found this really informative quote from an article when I was researching a little bit more for this. And I think that it describes what I would like to lead off with. Again, we'll talk a little bit about like the brain and the neurology side of this a bit. And then we'll get into like the local gut stuff and the neurotransmitters and mast cells and whatnot. But bear with me. So the article, if you want to go check it out, is called Irritable Bowel Syndrome and Visceral Hypersensitivity, Risk Factors and Pathophysiological Mechanisms. And this is an article from 2016. And they said, recent data suggests that IBS patients are over-attentive, hypervigilant, towards internal gastrointestinal stimuli. IBS patients show altered brain response to rectal stimuli, regardless of whether these stimuli are actually delivered or only anticipated. In these patients, alterations take place not only in areas involved in attention and perception, but also in subcortical regions involved in emotional and autonomous response to the visceral stimuli. Furthermore, it was shown that pain perception increases when attention is specifically focused towards the gut, whereas stimulus perception significantly decreases during distraction of the stimulus by a cognitive task. In this regard, the relation between anxiety and IBS may be an important factor contributing to hypervigilance and hypersensitivity. Anxiety towards painful abdominal sensations, may increase perception and even, oh, sorry, I lost my place. Anxiety towards painful abdominal sensations may lead to increased vigilance towards intestinal stimuli, which may in turn result in increased perception and even more anxiety, enabling a vicious circle of pain, anxiety, and increased vigilance. They went on a little bit more, and they basically said, like, we've done functional MRI studies, and we could see what areas of the brain are lighting up. They say functional imaging allows us to visualize brain areas involved in the processing of pain stimuli, and to study functional alterations in IBS patients. It is now established that IBS patients demonstrate an increased activity in brain areas associated with emotional arousal, parentheses, the paraguinal anterior cingulate cortex and amygdala, and parentheses, and endogenous pain modulation during rectal balloon distension compared to healthy controls. In contrast, controls show enhanced engagement in the medial and lateral prefrontal cortex, areas involved in modulation of pain and emotion and cognitive control of emotion. Increased activity in these regions is associated with a more effective downregulation of the emotional arousal circuit in controls. So all of that gibberish is to say, how many times have we talked about this on this podcast? Like, if you're experiencing a great deal of anxiety or health OCD, and you're constantly freaking yourself out, worried that you're going to react to a food, worrying that you're going to get bloated, worrying that you're going to get diarrhea, worrying that you're going to get pain, if your life is consumed by the IBS and you're not leaving the house and you're not working and you're not exercising and you're not living your life, if your whole world has shrunk to basically the world in your belly, and that's all that you're focusing on, that's all you care about, that's all you think about, you eat, talk, breathe, IBS, you're on the forums, you're in the YouTube channel, you're listening to podcasts, you're just, for lack of a better word, obsessed with this healing journey. If you let it consume you and suck you in, and you're paying attention to every little nose drip, every little twinge, every little thing, you are creating a vicious cycle that can and will likely lead to more pain, more bloating, more food reactions. And this has been documented with functional MRIs. And it's not to say, to be crystal clear, I'm not saying it's all in your head, you damn crazy person, just go take an antidepressant and your IBS will go away. I'm not trying to downplay the role of mental health. I'm not trying to be flippant and like shrug it off as like, a bunch of crazy people. I'm just saying that we need to pay a lot more attention to our mental health and how much we're letting the IBS run our lives versus going out and living your life a bit and frankly distracting yourself from the IBS so that it's not your entire world. Your neurology and the circuitry that you need to regulate pain and regulate your gut will benefit if you can live your life more than you currently are. So comments from Amy. That's my whole shit.
Yeah, I feel like it's sort of this cycle of, it's interesting because my own experience with anxiety, especially like throughout my life, I've been more anxious, obviously like way more intense postpartum than ever. And I think again, like it's interesting because this has gotten better throughout time, but there's something called anticipatory anxiety. And it's essentially like most people, if they have like a meeting at work or something that's really important, it's actually probably not the meeting that they're freaked out by from an anxiety standpoint. They're more freaked out by having the anxiety about the meeting. So like, so they're hyper vigilant of like, oh, am I anxious yet? Like, oh, I don't want to be anxious. Like, oh, this is going to be really hard. Or like, I'm really worried about this meeting or this or that. And so a lot of times like what happens is if we had like an anxious experience or something, because again, like maybe there was a time where your gut was really aggravated. And so you had that signaling of like, okay, man, last time I ate garlic, man, I was in so much pain and there was cramping. And so like in your head, you're associating like, oh, if I eat garlic again, you're anticipating that pain. Kind of like how you can anticipate the anxiety in the same way. Like you're anticipating that I'm going to react to this. And so I'm going to be hyper vigilant if I do eat it to look for the pain. So it's like weird because I think it becomes a scenario where like pain begets pain. So again, if you're hyper focused on avoiding pain, and again, you're just all your energy is on the pain in that scenario, it can really drive pain. And again, it's such like a hard thing to get out of because again, like it's not comfortable. Like the pain signaling that you're getting is real. But like the solution is not to be hyper vigilant and to like hyper focus on the pain, even though that's potentially what your brain wants to do. Like, oh my gosh, I'm in pain. I need to like pay attention to this and figure out what's driving it. That seems like a logical solution, but like in reality, probably spending less time thinking about the pain is going to be what's helpful. And it's interesting because that might be why hypnotherapy and things like meditation are so helpful for visceral hypersensitivity. Hypnotherapy in particular has been a little bit, there's been some interesting studies like comparing it to like low Fodmap and things like that for pain. And again, like when you're doing hypnotherapy for pain, it's like you're almost trying to imagine yourself without pain. Like you're doing the opposite of like being necessarily hypervigilant about pain, but thinking about how does your, like, what would it be like if your gut functioned optimally? Like you're almost imagining that scenario and being led down that scenario in a lot of the hypnosis type tracks that I've heard. So you're putting more emphasis on like, imagining life without pain. Again, like what does your gut feel like when it's thriving? Like you're spending more time and energy on perceiving that than the pain. And again, like that seems to be really helpful for visceral hypersensitivity too. But it's interesting because I think a lot of the like mental work can play a really big role in reducing the pain. And like I said, I think it's a very easy rabbit hole to get stuck in. Having personally had visceral hypersensitivity along my journey, like having gut pain is terrible. And so again, it can feel like all or nothing. Like I need to figure this out. I need to pay attention. Like it almost feels a little bit irresponsible to like not pay attention to it. And again, like that's something I think with like your OCD, my OCD journey, like whenever you're shifting your mindset, like away from something OCD, it seems like so important in your head. Again, so like the pain and the IBS seems so important. Like it's holding you back. Like, oh, it's so important. Like I can't just like let it go or again, like let pieces go. Maybe if you've been researching all day, just decreasing the amount of research you're doing to start. Like it doesn't have to be like all or nothing, but like just pulling back a little bit. It feels counterintuitive because that pain is signaling is so strong. But again, resisting, I think getting sucked in to this cycle and trying to do things that can break that cycle can be really, really helpful. I think a lot of like, vagus nerve type stuff, hypnotherapy, meditation. Interestingly enough, like I did read somewhere too, when I was prepping for this, that like even abdominal massage can be helpful. So yeah, again, like it probably therapy, that kind of thing could potentially be helpful. Go ahead.
May I share something though? So, like we've mentioned in recent episodes and kind of alluded to already here, again, like those things are useful and have some backing to them. So like hypnotherapy, like yoga, acupuncture, cognitive behavioral therapy, like a lot of these things have research for IBS, massage, but also I'm picturing like some people are going to build their life around these things and then still not live their life. Right.
Right.
So like, okay, I'm going to I'm going to spend 1 hour a day massaging my tummy. And then I'm going to exercise in a very specific way. I'm going to do this exact type of yoga because it's good for my tummy. And then I'm going to do breathing exercises because it's good for my tummy. And I'm going to do my CBT and I'm going to do and it's like, that kind of defeats the purpose and like misses the boat a little bit from what we've been talking about a bit. And Amy's talked about in previous episodes too, is like one of the pivotal points for you and your IBS is when you said, screw it, I'm just going to play half a game of basketball because I want to play basketball. Like, it might not be about starting a new tummy massage or starting, Nerva IBS directed hypnotherapy. It just might be going out into the world and doing stuff.
Yeah, 100%.
Go out to the park and hang out with friends, go for a walk and hang out with people, go to the beach, go play half a game of basketball, go take an art class, do something that would make life worth living. Like, that's going to be a really big factor. But yes, all the things that you rattled off are going to be helpful for this, certainly.
Well, and I think, again, like, there's probably a difference here when something becomes a ritual. So, like, with OCD, and again, even anxiety, like, there's coping mechanisms, or in OCD, there's compulsions. So, like, if whenever you have a gut pain, you have to stop and do a massage, or if you're always responding to the pain with these exercises versus like having, maybe you have a 15 to 30 minute window or something where you do something every day, but it's not in response to something. It's just kind of like a part of your routine. To me, that's a different thing.
It comes from a place of self-love.
Right.
Like,
right.
This makes me feel good. I deserve this. This is a nice, relaxing way to start or end my day, versus I have to do this because of my IBS.
Right. Like, again, and I think most like self-care or stress management type activities would probably help visceral hypersensitivity. It's just, again, like, the things that get the most focused are kind of the ones that have more structure, like hypnotherapy, like meditation.
Well, the ones that feel like a treatment.
Right. Exactly.
Like, those things feel like a treatment. We can research them. It's going to be hard to develop a research study where we just tell people to go do something that brings them joy, because that's going to be variable from person to person. And like, how do you track that?
Right.
Well,
like, and I think
one person, it might be a painting class, but you can't take a painting class every day, versus like one person, it might be going for a walk, and you could totally do that every day. So,
right. Well, I think that, like, it's almost a scenario where you have to be acting. It's weird. And I think this is something that's really helpful when establishing habits or changing patterns in any way. You have to almost act like you don't have IBS. So, like, what would you be doing if you didn't have IBS? Because action actually creates movement and progress. So, like, if you're just, you have to, again, like, act like you don't have pain, act like you don't have IBS to some degree. Again, like, there could be some limitations there, but I think
you can act like a health conscious person without IBS. We're not necessarily saying you eat Doritos for breakfast, lunch, and dinner because you're acting like a person who doesn't have IBS. Like, you could still eat vegetables and try to take care of your body. But yes,
I think again, like, if you can just like picture what would your day be like and how would it be different if you didn't have IBS, I think that's a really interesting question for people to think about. And the more you can embody someone without IBS, it can be a really valuable like tool to think about, and you can develop some valuable skills thinking through what that would look like. It's kind of, I think we talked about it before, like the be, do, have kind of model. Mm-hmm. Where, again, like, you almost want to embody what you want to be in certain ways first, and then kind of do, like, again, try to identify as someone kind of without pain or without IBS. And again, like, it might not be this simple for everybody, but like, it's still a very valuable tool to think through. But yeah, it's it's hard, but I think again, like if you're right, if it becomes like ritualistic or like compulsory or like a coping skill that you have to
Or if you
do,
have to do it. Yeah.
right, like there's a level of urgency, then it probably isn't valuable. Now again, like I think that there's
Well, or
like
that's a
from
red
like
flag
a
for some mental health stuff that you might want to untangle.
right. Well, and again, I think like there's so many flavors of like, you have kind of maybe OCD that gets a little bit more extreme with like compulsions. Then you have kind of anxiety, which can still kind of like have some coping mechanisms and some urgency. But I do find that, again, like some people with, again, a lesser degree of anxiety could benefit from, the hypnotherapy type things because they can kind of like do it without it becoming urgent, compulsory, ritualistic. At least that's kind of been my experience. Like some people get a lot of value out of those things, but like, yeah, you're dead on. Like if it does, and I think with those people, you still want them out there living their life too. Like that's probably the most important thing is that you're living your life and you're still going after your goals, dreams, despite maybe even having some pain. Maybe you're doing that and you're still having some pain and like you still feel like you're kind of going through your day and you're doing the best you can, and maybe you aren't like hyper focused on this stuff to some degree. Like maybe you are kind of going through and you're still kind of noticing some pain. This is still an important box to check off. Like you need to be engaged with your life. Maybe there's more of like a microbiome piece to your puzzle that needs to be corrected to some degree. If you're kind of out there living your life as best you can, you're engaged with your loved ones, you're pursuing hobbies, you're enjoying your life to some degree, to a decent degree. Like if you feel like you're checking all those boxes and still having some pain, you could certainly explore other things too.
Yeah, and it's not to say again, like I'm gonna like watch and wait for this particular episode to get it like one crabby comment on YouTube of
Yeah.
like, don't watch it, guys. They say it's all in your head. 0 out of 10 stars. Like eventually we're gonna get one comment on this episode that's like that tone. But to be clear, again, like hopefully this isn't your first episode with us, so you kind of know some of our deals by this point. We're not saying, oh,
Right.
just like ignore your IBS and it'll go away magically. And like, it's all in your head, you damn crazy person. Like, get out of here. Like, it's not that. It's just that we do, like, honestly, we do see a lot of people who come to work with us and they are in a very deep, dark, isolated place.
Yeah.
Frankly, a lot of the people who work with us are not living their lives. They are not enjoying their lives. Their relationships, they have isolated themselves from a lot of relationships that they once had. A fair amount of people no longer work. They no longer have hobbies. They basically don't leave the house. And their life is consumed by the IBS. And everything they do and breathe and say and eat has to do with IBS. These are the people that we wanted to really talk about right now, because like those are oftentimes, not coincidentally, the people who have the most severe pain. And like there's a little bit of two sides to the coin, right? Like they have constricted their life so much, probably in part because they were in pain. And so
Yeah.
they felt like they had to withdraw and like they couldn't do anything and they couldn't work and they couldn't have relationships and they couldn't go to school and they couldn't work. And it's like, I think that probably how it happens is like there's some degree of pain or dysfunction. So you constrict a bit and then there's more pain or symptomology and then you constrict more. And
Right.
it's this vicious cycle until you whittle your life down to almost nothing other than the IBS. And we
Well,
just
and the
wanted
pain
to,
so much, like again, the pain has gradually
the pain has gotten worse and
as
worse.
you've contracted from your life, your pain gets more intense.
As your world has shrunken down
Right.
to only your gut, the pain is getting worse. And like it kind of makes sense neurologically, right? Like if On some level, if we hyper focus on one thing, we are signaling to our nervous system that that one thing is everything.
Right.
Right. Like if I only focus, I'm trying to think of like
Oh, I have a good
another
analogy for
example.
this.
Ooh, okay.
So, like, if you think about your social media feed being an algorithm, so like, what do you want your algorithm to look like? In your head, from an IBS standpoint, it's just pain, 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 because all you're thinking about is pain, gut symptoms, maybe some bloating mixed in. Like all you're thinking about is gut symptoms. And that's like where the importance is lying in your brain. That's what you're paying attention to. So your feed just becomes more and more that stuff. Maybe your feed at the beginning was like, oh, my daughter's dance recital. My work is this. Oh, pain. And the pain kind of gets so intense that it draws you in. And then again, you get more ads for that pain throughout your feed.
It's just like social media.
Yeah, and it's just this never-ending thing. And so, again, I think thinking of it as almost an algorithm, like where do you want your brain to be paying attention to? And it's really hard if your brain has been sucked up into that because you have all these ads now on your feed. Like you have to engage in other things for different stuff to pop up.
You have to seek out other accounts. Like, all right, for example, we're recording this towards the beginning of the year still. And everybody's still talking about resolutions and self-improvement and stuff. Well, I was a dweeb and I bought myself a journal, like a journal for self-improvement and like mental health. I bought a journal in January, like a rube. But then I'm getting still all of these advertisements for other types of journals. And I'm laughing about it because I'm like, okay, guys, I know I engaged with one advertisement,
right?
But also I purchased the thing from the advertisement. So I no longer need the other 500 journals you're recommending to me. So you need to stop. But it's like, you have to go out and intentionally search for other material to fill your newsfeed and gradually shift the algorithm. And it's not going to be overnight. Like I'm still getting ads for other journals.
And now that you've said journals about 6 times, your phone has heard
I'm
that.
I'm going to get more because it's totally listening. Yes.
Right.
Absolutely 100%. I'm convinced that they are listening audibly to our every word.
Oh, 100%.
But like, that's the perfect analogy to this. If your brain news feed has a good mix of like hobbies and work and relationships and, work and school and family and yummy food and funny jokes and like whatever, and like animals and cute things. If you have a nice news stream with like 20 posts and only one of the 20 posts is about pain, you're not going to register that as nearly as important or significant. Right. But again, if you start engaging with those pain ads and you start, now I'm going to get pain ads too. I'm going to get like migraine clinic ads or something. But, if you start engaging with that content, the news feed is intelligent. The algorithm is intelligent and it's learning really quickly based off your behavior. And you're going to get 19 out of 20 of your posts on your newsfeed are going to be about pain. And it's going to be that much more urgent and severe and scary and real. Again, like all of this is real in the brain. When they are doing these functional MRI studies, they're not saying, oh, these patients are imagining pain. They're literally writing about it and saying that they are in pain. And here are the brain regions that are lit up that are telling us that they are in real pain.
Right.
Pain is a cortical event. Pain is a brain-based event. So it's not even to say like, oh, the pain is all in your head, because all pain is in your head.
Right.
Like, that's the definition of pain. You can't have pain if you don't have a central nervous system. Right. If you were just a spinal cord flopping around in the breeze, you would never feel pain. God, can you imagine that life form that I just described there? I guess it would be. I
don't really love any like cord flopping. Like, yeah, snake. Oh, I hate snakes. Yeah, it's like feels very snake-like.
Yeah, let's get off of that tangent real quick, because yes, we're painting some imagery that maybe we don't want to paint. But all right, acknowledging again that there's a very real tie-in with mental health and brain health. One more thing to say on this topic, and then we could go hunker back down in the gut for the remainder of the episode. You could also look at any chronic pain, including visceral hypersensitivity and gut pain. You could look at it from the perspective of, okay, I need healthy neurons and healthy neuronal networks in place that are able to dampen the pain signals and weed out the dud signals. So what can I do to make my nervous system healthy? What can I do to improve the health of my neurons? Like, what do neurons need to be healthy is another way to word this. So I think I've mentioned this before, but like, shout out back to Datis Karazian. He always taught this really well. Neurons need a stable supply of fuel, namely glucose. So just making sure that your blood sugar is well controlled. You're not dipping too hypoglycemic. You're not getting too hyperglycemic. Certainly if you have diabetes or prediabetes, you've got to get on that. But blood sugar regulation, super, super important for neurons. Remember, there's even research that the vagus nerve whizzles up into nothing practically in diabetic patients compared to healthy controls. Like you lose girth of your vagus nerve when you have diabetes for a prolonged period of time. So,
God, we all need that vagus nerve girth.
All the girth. The beefier, the better, man. The beefier, the better. This is where size does matter.
Yeah, size does matter.
Totally inappropriate. So blood sugar, number one. Number two, your brain needs oxygen. If you have anemia, or if you're deficient in iron or copper or B12, that's not going to be a good situation for your brain. And again, like both of these things, like blood sugar regulation issues and iron deficiency, both of these affect like 50-ish% of people with IBS. So these are soups common.
Well, and I will say too,
like your brain.
Well, and it's easy to rule them in or out too. Like it's not necessarily something that like, you know, it's a little bit like elusive to pin down. Like even from like, you know,
conventional medicine can do this.
Right. Well, and even like, you know, microbiome takes interpretation of like what to do and things like that to some degree. I mean, these are pretty concrete. They're pretty concrete to diagnose, and then they're also pretty concrete to treat. Like there's a lot of different ways.
And we have episodes on both.
Right.
Once again, I could direct you back there. We have episodes on like high blood sugar, low blood sugar, iron, B vitamins, you name it. But these are like the two most foundational things that neurons need. They need oxygen, and they need good blood sugar regulation without big swings up or down. The other thing that neurons need to be healthy and keep them alive is they need stimulation. If you put a neuron in a petri dish all by itself and it's just twiddling its thumbs all by its lonesome with no friends around it to stimulate it, it will whizzle up and die. It's kind of the old like use it or lose it mentality with neurology. So this is where, again, like living your life and doing things that are novel and unique and like stimulating and having conversations with people and like going out into the world and living your life, that is stimulation for your nervous system in and of itself. Yeah. But also exercise. Like if you can move your body, particularly in unique, novel, challenging ways, then that is stimulation for your nervous system. And what I mean by that is it might not be the be all end all if you're like on the treadmill doing the exact same repetitive movement for 2 hours a day. But if you could do a little bit of aerobic exercise and then a little bit of dancing or a little bit of yoga or like Tai Chi or something where like you're challenging yourself to move in ways that you haven't done before, or like the type of movement requires some coordination or some skill or some practice, like do a form of exercise that the first time you do it, you totally suck at it. And then you can improve the skill and get better. I guess that's a way to think of it.
Yeah. I think a lot of like, even weightlifting that incorporates like balance, like there's a lot of interesting like free weight type movement exercises that can be really interesting with the brain. Just because it involves like coordination between a lot of different muscle groups at one time.
Yeah.
So again, like there's a lot of ways you could potentially do it. And you could incorporate different movements in, but I like that idea. And I think from a stimulation standpoint, it's like anything that you feel like lights you up in a certain way, like that's almost how I would view it. Like anything that really like brings you a lot of joy, or like you're like, oh, I'm just like so engaged in this conversation, or I'm so into this football game, or I'm so like into this exercise or
K-pop
movement.
performance.
Right. Like again, anything that like you just are just hooked. Like those are the types of things that you might want to do more of. Or again, like
Things
trying
that
something
speak
new.
to your soul.
Right. Right.
Yeah, and yeah, trying something new, trying something novel that you haven't done before, so it's completely new to your nervous system, or it's
Right.
foreign to your nervous system. Yeah,
Right.
I think that those are kind of my three tenets of functional neurology 101 that I wanted
Right.
to share. You want to maybe start us off a bit. So we started up high with more like central nervous system, brain based stuff.
Right.
Now let's do the flippity flip and let's go down south to the gut itself and more local mechanisms, or
Yeah.
things that would influence the gut directly. And ironically, I think that most people with IBS and most people with IBS pain assume that the pain has everything to do with their gut.
Right.
Like, oh, it's the microbiome, it's a bad bacteria, it's a fungus, it's a yeast, it's a parasite, it's a whatever. So if I may suggest, maybe brief mention of the microbiome
Right.
first, but I don't know if the microbiome is leading the charge with visceral hypersensitivity to the degree that a lot of you probably assumed before you came to this episode.
Right. Well, and I think again, like to me, it's almost interesting because it could like there's maybe scenarios like post-infectious issues where there was a bug in there that really just did a number on the nervous system, but then again, like the infection has passed and there's like remnants of nerve dysfunction post that. And I think again, like potentially if there's any big major change in the microbiome, it could like potentially affect some signaling in there, like antibiotics, that kind of thing. But yeah, I mean, I think it is really interesting. If someone has major dysbiosis, definitely there could potentially be pain it can be contributing. I think again, it's like a scenario of looking at it as a pie. Like, the microbiome could be contributing a certain percentage. The central nervous system, or nervous system stuff in general, could be contributing another percentage of the pie. So it's like, what way do you swing? And again, like probably people overestimate the microbiome piece and underestimate the nervous system piece. But yeah, I mean, again, I think that like potentially doing some microbiome work could help with hypersensitivity, depending on, again, like what's going on in the gut. I know we were going to talk about like histamine stuff too, which again could be being driven by stressors and anxiety and mental health stuff too.
It's all woven in.
Right. But then again, like gut stuff could also be driving some additional histamine release. So again, like everything's connected. So probably like to some degree trying to figure out, or again, maybe it's not as important to try to figure out, but like trying to make sure you're doing everything you can to help your nervous system be healthy. While maybe doing some gut stuff as well from like a microbiome standpoint, if there are things that are off. But I don't think you can like necessarily just assume out the gate that it's 100% a microbiome issue, or 100% a gut issue. I think people, again, like kind of assume like the gut brain axis, that it's kind of going that way, like the gut to the brain and not the other way around ever. So
meanwhile, there's quite a bit of regulation from the brain going down to the gut. I forget the exact split, what's going up, what's going down.
I think it's like
I think it's 80-20.
Yeah,
Like
it's something
80
like that.
going down, 20 going up, but I can't swear to that. Yeah, I love the idea of the pie chart.
Right.
And now I want pie. Thank you very much. So
Mwah.
I'll have to just deal with that wanting of pie. Although we're recording this on my husband's birthday, so we're gonna have cake tonight. So I guess that'll have to do. But yeah, it's like I think that most complex illness is a pie chart, right? Like if we could identify the cause of migraine, we
Right.
would have discovered it and we would have cured it, and we would have targeted it with a drug. If there was a single cause for visceral hypersensitivity, we would have discovered it, we would have targeted it. But no, when you read these papers, there are tons of different mechanisms that have been shown to play some role. And it's like, I think with the pie chart kind of conversation, a lot of how I see it is, can we identify the biggest pieces of the pie chart for that individual?
Right.
And try to tackle the big pieces first, because that's more likely to get symptomatic resolution quickly. Then we can get into like a fine tuning stage where we start working on the little itty bitty bits. And just acknowledging again, like all of this stuff is connected. So again, like the mental health, stress, your world has shrunk to only your gut. Like there's evidence that corticotropin releasing hormone and cortisol, all of these so-called stress hormones, degranulate mast cells and trigger mast cells. There's evidence that those same stress chemicals make your like nociceptors, those pain receptors, more hypersensitive to pain and painful stimuli. Stress is going to mess with your hormones, like your sex hormones, and that seems to play a role with visceral hypersensitivity.
Seems like it's more, just like IBS, it's more common in women than men. I think we
Yes.
kind of have way more intricate hormonal chemistry.
We do.
Which-
We're the advanced half of the species. The men
Right.
are the simpletons with their daily patterns of testosterone regulation. But I'll share this. I actually had this queued up to share too from the beginning of the deep dive I did for this episode. So another little quote, but this one's shorter. Sex hormones are a significant contributor to the stimulation of visceral hypersensitivity process in animal models. Estrogen participates in the development of the stress-associated visceral hypersensitivity in female rats. One of the ways that they induce visceral hypersensitivity, by the way, is by separating baby mice from their moms. And then they watch and they like see if those mice develop pain more frequently in their adult life. And the answer is yes. So there's even the conversation of like childhood trauma.
Well,
and
yeah,
like maternal separation, like stuff like that.
Right.
Could be priming your nervous system later on to be hypervigilant and have more pain. But
Right. I
this
think
was interesting.
I was just going to say one thing just that comes up again, like weird mom Instagram stuff that comes up. There was some study that was saying if a child is a meter away from their parent, their cortisol levels increase like overnight.
What?
Yeah. So like even being over a meter, they showed that kids had higher cortisol than if they were closer to their parent.
Huh.
Even like maybe like not bed sharing or whatever, but just like if the proximity gets beyond a meter, there seems to be an uptick in cortisol from a baby standpoint, which is wild.
Interesting. Yeah. Well, it makes me glad that we did a lot of like skin on skin and holding Jess when she was a
Right.
baby.
Right.
Yeah. Well, yeah, that was interesting kind of tangent. But what I was going to share, they said, well, first off, they said estrogen contributes to the central sensitization of visceral pain through spinal activation of cyclic AMP response element binding protein pathways, which modulate the pain signal in the dorsal root. So estrogen is doing stuff in the spinal cord that affects your ability to modulate or control or regulate pain signaling. This is the kicker though. Loss of gonadal, so gonads would be like your ovaries and your testes. Loss of gonadal hormones in rats who had their ovaries removed significantly blocked the pathophysiological process of visceral hypersensitivity, which is then reversed by administration of exogenous estrogen.
Whoa.
Now, this is a mouse model or a rat model,
Right.
right? So it's not humans. They didn't yank out the ovaries and then wait to see if they got visceral hypersensitivity or not.
Right.
But it does make you wonder. And now here's the kicker. You ready for this tangled web of craziness? I think we have an episode on estrogen dominance type stuff and sex hormones. So again, you can refer to other episodes about any of these if you need a deep dive on it. We're just giving you the overview and like how some of these things connect to visceral hypersensitivity. But okay, we've got neurology and that conversation and your ability to regulate or dampen or control pain signals. We now, from that article, we see that estrogen is directly involved in that process at the spinal cord level. Also, higher amounts of estrogen prompt mast cells to degranulate and release all of their stuff. And estrogen is BFF friends forever with serotonin. If you're going to like pick a bestie for estrogen as far as neurotransmitters go, estrogen and serotonin tend to have a lot of interplay between them. Well, serotonin receptors are also implicated in the world of visceral hypersensitivity. So we've got all of these factors. We've got estrogen, probably like more problematic if you have too much estrogen relative to progesterone, like the estrogen dominance kind of conversation seems to be most relevant. But you've got neurology factors. You've got estrogen dominance playing a role. Mast cell and histamine stuff playing a role because there's a buttload of research on that patients with IBS have more mast cells and they are more active mast cells releasing histamine and their chemicals, and that the mast cell degranulation is irritating the nociceptive neurons and initiating that nociceptive signal. So we've now got neurology, we've got estrogen dominance, we've got mast cell and histamine issues, we've got serotonin issues, and as the kicker, of course, the microbiome can influence a lot of this. So you have microbes that can make neurotransmitters. You have microbes that can stimulate different receptors, like serotonin receptors. We have microbes that could either produce or digest histamine for you. There was a Lucy Mailing article on her blog not that long ago highlighting a newer study that showed that there's a particular species of Klebsiella that seems to be the main histamine producer in the gut. So there's that interplay with like dysbiosis, SIBO-y kind of stuff. But I think that visceral hypersensitivity, and there's a lot of research on just inflammation.
Right. Inflammation, permeability in the gut.
Yep. Yeah. Like more T cells infiltrating the gut, prostaglandins, which think about like good fat, bad fat kind of balance is one thing that comes to mind with prostaglandin synthesis, opioid receptors, and like cannabinoid receptors. There's a lot of different receptors, but I think the main things to think about for visceral pain tend to be some the pie chart for most people is going to be some combo of neurology, estrogen dominance kind of stuff, mast cell histamine stuff, serotonin stuff, and microbiome stuff. And inflammation is thrown in there for funsies. Those are probably the big six as far as like things to maybe have on your radar when trying to identify the biggest pieces of your pie chart.
Yeah. For
and again, we've got episodes on pretty much all of this. So if you want a deep dive on mast cells and histamine, go for the gold. If you want a deep dive on estrogen, we got that too. If you want a deep dive on, what else did I say? Iron and like blood flow and anemia type stuff, B vitamins, we've got that. So I think we've got you covered in a lot of regards as it pertains to this. But that's the pie chart as I see it. Do you want to?
Yeah, no, I think that's awesome. Like, I love that. I think we all want it to be such a linear thing, and it just usually isn't. And part of the problem is that all these things interfeed or like interplay with each other. So again, the microbiome is going to affect neurology potentially, and then neurology is going to affect the microbiome, and then could affect mast cells. And again, all these things are just connected in so many different ways. So it can get a little convoluted, but at the same time, usually like, you know, some people are going to present more so like, oh, they had a post-infectious event. And like, we might need to do specific things to help with that. Or maybe they are experiencing tons of anxiety or like hypervigilance. You would need to really pay attention to mental health stuff for that person. So it's kind of just going down the list and seeing like what feels most relevant to you. But yeah, I do have to wrap up here soon. Should we talk a little bit about like different things that could potentially help? I do want to kick it off too with like, there is, and we mentioned this in Horlax episode, but like there is some evidence about your boyfriend.
My bestie. My science crush.
Right. But how low FODMAP can help with hypersensitivity. And again, like it's not necessarily addressing the root of the problem. It's like a symptom management tool. But again, like I do think, you know, there is some research to that. It would not be my go-to strategy for this at all. But again, like why some people might feel better going low FODMAP probably has to do with like less stretching in the gut, like less pressure, less gas being produced, that kind of thing, like just less sensations going on in the gut from being low FODMAP. So it's not necessarily correcting any of the underlying issues. It's just kind of like helping mediate a bit, which isn't a bad thing. It's just you don't want to rely on that at all long term.
Yeah, it's quieting down those nociceptive neurons. It's reducing the stimulation that could be mistaken as painful.
Right.
Right. It's kind of like, I guess like the best analogy I could think of is like sometimes people with like fibro will be so hypersensitive to pain that like even the littlest touch is painful to them. So they might go through their life telling people like, do not touch me.
Right.
Do not touch me. Don't hug me. Don't tap me on the shoulder. Don't do anything. Like I can't. And like that is a viable coping strategy, but it's also not solving the problem. It's not treating the fibro pain. Right. So it's the same thing. It's like you could reduce the stretch and the stimulation in the gut that could mistakenly be perceived as pain. But the ultimate goal is to just fix the mechanisms behind the pain and like get your body and get your neurology to a point where it's not so hypersensitive to pain.
Right.
And this is worth mentioning, and I might botch this and embarrass myself. Hold on, let me pull it up real quick. There are two terms that might be worth noodling on that I maybe should have started the episode on. So there's something called allodynia. I had to look up the spelling so I don't embarrass myself. It's ALLODYNIA. Allodynia is the perception of pain from a stimulus that normally would not be painful. So that's what I just described with fibro, right? Like doing this or like a hug shouldn't elicit pain, but people with that sort of pain are experiencing allodynia. They're experiencing pain when there should be no pain from that. Some visceral hypersensitivity is that, or again, it's like just a few gas bubbles, or it's just the feeling of stool moving through your colon. That shouldn't be painful, but some people experience very real pain from that. That's kind of its own neurological phenomenon. There's also hyperalgesia, which is like something that would normally cause a minimal amount of pain, now causing much more pain than would be normal. So if somebody like pinches you and it feels like a gunshot, or if somebody, you know, kind of just like taps your face and it feels like they just like punched you in the face.
Well, I almost think of it like from a gut standpoint, like regular people might get bloated from broccoli or beans, but like someone with that sort of issue going on would like feel more pain from it.
Yeah.
If that makes sense. Like you might not feel great if you slammed beans just as an average person that you don't eat beans, but like it wouldn't be as intense as someone that's dealing with that particular
It wouldn't be
issue.
cause for concern. You would just be like, whoa, I had a lot of beans.
Right.
And that would be kind of the
beans.
end of that.
The more you eat, the more you toot.
The more you toot, the better you feel. Now you're ready for another meal.
Whoa.
Yeah.
Never heard that before.
What? Yeah, there's two. Let's see. There's also, now I have to think of the whole little sing-song. Beans, beans, the magical fruit. The more you eat, the more you toot. The more you toot, the better you feel. Now you're ready for another meal. I feel like there's another variation of this too, though. Anyway, but I know we have to wrap up because you're right, Boob is probably angry at us. Let's briefly, at the end of the conversation, now that we talked about the stuff that people need to know, let's talk about what they want to know, which is what magical herb or pill can I go to Amazon and buy right now that will magically cure my pain? I say this totally being a jerk about it. I'm sorry, but I don't know if it's that simple or that easy or that linear, but for what it's worth, here's a couple of ideas. We just talked about a few with Jason Haverlack, my bestie. Sorry, Amy, take a back seat. Jason Haverlack, take the spot as BFF forever. He had mentioned iberogast and curcumin in combination. He had shared that it can take a few weeks or a few months to really kick in, and that's important to know. I didn't realize that actually, so that was huge for me to know. He also mentioned a combination. Do you remember what it was now?
Peppermint and
caraway?
Peppermint and caraway. He said he had people do teas sometimes.
Yeah. So there's that. I believe I saw at least one study recently on it was an essential oil blend, and it was those two essential oils used. I think in a gel cap of some sort. So those are the ones that came up with Jason Haverlack. There's one probiotic in particular that I've used for this, and that's the oh God, what is it?
You said it on the episode. I think it was like
it's the 299V.
ideal bowel support.
Is it Lactobacillus plantarum?
Yep.
I think. Yeah,
Yep.
299V strain, and that has been shown to help with visceral hypersensitivity, and it has seemed to help some of my patients. There's a fair amount of research on probiotics helping this.
Right.
Too. So just probiotics in general could help. Other things that I came across, I didn't get a chance to read the articles, unfortunately, but just based off of the titles and the abstracts that I saw, I thought I would share. There's at least a couple of papers suggesting that berberine can help with visceral hypersensitivity.
Yeah.
There's a couple of ways that could shake out. Maybe it's because it's antimicrobial, but I actually, from the papers that I did read, it seems like it's not an antimicrobial thing. Because I know everybody in this world is slap happy to kill all the microbes. And if an antimicrobial makes you feel better, it must be because you killed the bad boogeyman.
Right.
With berberine, what they've seemed to indicate is that it's either influencing inflammation, influencing the immune system, or it's interacting with some of the receptors that are implicated in visceral hypersensitivity. There was one in particular I remember that they mentioned. So berberine, there was a couple of papers I found on that, probably not because of the antimicrobial thing. It seems to be other mechanisms, but that's something that is, you could certainly do a capsule of berberine 2-3 times a day and kind of hunker at that and see if that helps. Quercetin also might help. There was one paper I saw on that. I did see. So yes, the essential oils of peppermint and caraway. There's a proprietary extract. It's menthocarin is the name of it. And that there was a study in 2018. And then the most recent, there was a 2022 paper I pulled up that suggested that human milk oligosaccharides, so 2FL
prebiotics,
kind of stuff. Yeah, that can also help visceral hypersensitivity. There's at least one paper from 2022 looking at HMOs. So this would be 2FL, Holy Ghost kind of stuff. Yeah. So you can look into that as well. But those were a few of the things that I was able to pull up as far as natural therapeutics and herbal interventions that might be helpful here.
Yeah, no, I agree. I think again, a lot of stuff that's kind of anti-inflammatory, like you were saying, I think could be helpful. I know we talked a little bit about butyrate too. That was another one. But yeah, you're like my baby's been like wailing the last like 10 minutes. So I'm like distracted.
That's all right. Well, go
Maybe
attend to
wrap it
said
up.
wailing baby.
I know.
Like you said, she likes you the best. You're the one with the magic boob.
I know.
Among other talents, for sure. But I'll keep the outro brief, guys. Thank you for tuning in. We will see you in the next episode. Per our usual, we'll bring you more truth bombs and more amusement, hopefully. And in the meantime, keep on keeping on, and we'll see you before you know it. Toodaloo.